Welcome to begin to join the iCON seminar. So please listen to the following announcement. If you would like to listen to the presentation with Mandarin or English audio, please click the Zoom link in the section, information section. And today, this forum is being conducted in Cantonese. So besides the forum, today we are having a lot of booths. We have arranged different organizations in the community to hold booths, introducing relevant health information. So you can also go on air platform after finishing the seminar, you can click and join. And also at the same time, during the seminar, there will be a lot of questions that we would like to invite participation. These are poll questions to help to collect all your information so that we can improve our future events. And after 1 or 2 months, we would be having workers to continue follow up over the telephone. So maybe let us try answering to the first question so that we can get used to how to manage when there are poll questions. So the first poll question. So here it is. The first question, let us give it a try. So what is your biggest health concern as you get older? We have 5 choices. You can pick the one that applies to you the most. So you can see that on the right side of the screen, there is a pull-down menu, and you can choose the answer that applies to you. Okay, so we have just stopped the polling, and I suppose everyone has given in your answer. So later on, during the seminar, there will be different poll questions, and I hope that I can invite your participation. And today, we have arranged a question and answer period on the floor. Actually, we have already received quite a few questions when people got registered, and we try to answer them all. And also, you can look at the top right-hand corner. You can see Q&A. You can write in English or Chinese. And we would like to answer your questions as far as we can towards the end. And okay, let me introduce myself. I'm Barbara Ho, the Chief Nursing Officer of the Chinese Department of iCON. Hello, everyone. Welcome to participate in today's iCON online Chinese seminar, Take Charge of Your Health, Stroke Management and Prevention. So if you're not used to our iCON activities, I would like to have a brief introduction of what we do. iCON is one of the projects initiated by the Digital Emergency Medicine of the Faculty of Medicine at UBC. The main purpose is to help people in multicultural communities understand how to prevent and self-manage chronic diseases by holding health seminars, workshop, and using network technology. We strive to share the most accurate and reliable health information with you. Not only do we hope that local people will immediately participate in seminars and other activities, we also hope that this health information can be extended to more remote areas and overseas through live webcasting and help everyone to work together to improve their health. And first of all, we have the director of the Department of Digital Emergency Medicine of UBC School of Medicine and the executive director and founder of the iCON. He is also the host of this seminar. So we have Dr. Ho here to welcome everybody. Dr. Ho, please. So thank you, Barbara. Thank you, everyone. So we have our familiar friends, we have seen you, and then we have new friends who come to our activities the first time. I'm Kendall Ho. So as Barbara has said, I'm a professor in the UBC School of Medicine and also iCON's director. And then representing UBC, I welcome everybody to come. And I'm so happy to see that so many of you are interested in your own health and the health of your family. And today's topic is about stroke. So looking back, it's already 1 year. The last year we had it was February in 2020. And I have seen those participants who took part in person in our last seminar. But because of the pandemic, we have changed it to be held on air. And I'm so happy to see our old friends and then new friends, not just in BC, but also in other out of town and even internationally. And I thank you very much. And this is the first time we are doing webcasting. So if there is any inappropriate or not good enough, so please pardon us. And we would like to hold the event as best we can, and we have a question and answer. So we are going to see many specialists here. And we have a lot of information, and I do not want to withhold your time. However, in BC, we are very excited. And during this month, we are going to have the vaccine rollout. And the COVID vaccine actually poses a threat to everyone. However, because of the effective vaccines and then because of the rollout, I would like to call upon everybody to try, whenever you have the opportunity, to receive the vaccine to protect yourself as well as the society. And I'm really happy that we have the opportunity. So at the beginning, I would like to introduce Ms. Lindsay Ossault. It's my honor to be able to introduce Lindsay Asker. She is the director of the primary care quality and then primary care division. And we are very honored to have Lindsay here to have the opening remark. So she also has a patient as partner, and she's the director. And I'm really happy to have Lindsay to welcome everybody. So may I ask Lindsay so that you can join us and give us some opening remarks and welcome our audience. Good afternoon, everyone. Thank you for having me here. I'm really excited for today's health forum. And as Kendall said, I'm in the Ministry of Health. And I'm coming from Victoria, where the ministry is allotted. And then I would like to acknowledge that I'm doing this on the traditional land of the First Nation people. And the primary care is happening is nothing about me. The main thing is to include the family and the family members. It's not only the right thing to do, it's also an effective way to make the health patient better. And we all agree that COVID-19 has really posed a lot of health hardship. And we also see the strength in the multicultural community, especially the Chinese community, but we try to find ways to stay connected. And we see so many people in this forum is amazing. It's really hard to think of another organization that can do such a marvelous job than the iCON. So that's why they are holding it today. And they have done this for over 10 years, and it's been amazing for the past 10 years. And we really look forward to the successes that they have achieved so far, and then may them be more successful in the future. Today's presentation, we have been empowered with health information and skills so that we can do what we can do to prevent a stroke. I'm very passionate about the topic because in my family, we have the history of stroke. So that's why we would like to be healthier and then improve our quality of life. I'm so passionate about this, I can't say more. So I really hope that you find the forum very valuable, and then you can take in some information and make some changes, and also encourage you to go to some resources after the presentation, including the iCON resources, and also there are a lot of websites that you can go to. So in closing for myself, on behalf of the government, I would like to thank you for joining this call and then being involved in your healthcare, and for everyone supporting this to make this event successful. Thank you very much. Hi, Lindsay, thank you so much for taking your time and welcoming the audience on behalf of the Ministry of Health. So we do thank Lindsay to deliver the welcoming speech. So I pass the time to Barbara. Thank you, Kendall. Thank you, Lindsay. So without further ado, I would like to go to the first section because we have a lot of content, therefore we split them into 2 days. So the first day today is talking about types of stroke, risk factors, prevention, which is very important, diagnosis, treatment, and rehabilitation, and so on. And because of the pandemic, so everyone is very cautious with the pandemic prevention. And therefore, even if somebody feels unwell, one is reluctant to ask for help, try not to come into contact with other people. So there is much less opportunity to see the doctor, and you may overlook other conditions that should be managed. And today we talk about stroke, and this is our hope that everybody can learn more and pay more attention to it. What is stroke? How does it happen? If unfortunately it does happen, so what should be done? And what is the recovery process? Because the condition of stroke causes great changes and impact on the patient, both physically and psychologically. Not only that, the family who act as caregivers also face considerable pressure. So after the patient returns home, what program or services are available in this community? So we will explore all these today and tomorrow. And we are much honored to be able to invite a group of dedicated and enthusiastic medical professionals to join us. In addition to being guest speakers, they also take time out of their busy schedule to plan the schedule. Although Dr. Ho is on call, he comes today. So let me introduce our panel of guest speakers. There are 4 of them. The first one is Dr. Thomas Ho. He is a family physician. He's been working in Vancouver as a family doctor for over 40 years. And he also received a certificate of honor from the Canadian Association of Family Doctors in recognition of his contributions to the elderly. The next one is Jojo Wang, a registered dietitian. And well, maybe you are very familiar with her because she has been with us for many forums, and she is specialized in the management of chronic diseases. And the next one is Dr. Samuel Yip, and he is a neurologist. He comes all the way to our forum today. And the next one is Dr. Richard Ho, who is a physical medicine and rehabilitation specialist. And he graduates from this specialty in UBC. Without further ado, Dr. Ho, can you talk and chat with the few specialists? So talking about
we're talking about stroke. Now the plan now is that I will have a dialogue with each of the panelists. First with Dr. Ho. After that, we will have the Q&A session. Now, while you're listening, you may also ask questions. In the upper right corner, there's the Q&A icon where you can click on. And so we will answer your questions during the Q&A session. Now, first of all, someone who is you're all very familiar in authority, a doctor who's been a panelist on our iCON forum for years. Now, Dr. Ho Thomas, how are you doing? Good. How's everybody? Thank you for taking your time and talk to us today. And now, strokes. Many people are concerned with that. Like Barbara said, a lot of people, when they registered for this, they wanted to know about the prevention. Now, you've been a doctor for so many years. You've seen so many cases of strokes. So what are the risk factors that will lead to strokes? What's your take on that? Well, maybe first of all, I will use practical clinical cases to illustrate. I use these 3 cases to illustrate the high risk factors and how to prevent them, how to lower those risks so that those people who have suffered strokes will not have them again. So very briefly, I will touch on them. The first scenario is an 82-year male and who is a professional. He's very active socially. He has hypertension, although he is taking high blood pressure medication still at 150, and he's also diabetic. And his 3-month average is between 7 to 7.6, and also high in cholesterol. And he also has a little bit of heart failure, but he likes to eat, but he doesn't want to abstain from any foods. However, he has a belly, and so his waistline is about 40 inches. One thing special about him is that his heart rhythm is, we call it atrial fibrillation. He thinks that the blood thinners that he takes is causing stomach upset, so he is not taking those. One day, he was feeling fine in the morning when he woke up after breakfast. All of a sudden, when he talked, he was incoherent in his speech, and then he was wobbling and when he stood. So also some numbness, tingling in his arms and legs, and poor balance. So after I examined him, I diagnosed him that he has a cerebrovascular stroke, and this was the first case. And the second case is a 58-year-old male, and he's a businessman, very busy. He likes to drink a lot of coffee or alcohol, and he also suffers from high blood pressure and takes high blood pressure medication. He has family history of stroke, and his cholesterol is 7.6 good, one is 5%, and the bad one is 5.2. But however, he's heard that the cholesterol medications are not good for his liver, and so it also causes muscle pain. So he doesn't want to really take cholesterol medications, and he is not active in doing exercises. So all along he's been fine, but one day while he was driving, all of a sudden he is weak. He feels weak all over. So he was holding onto the steering wheel and has difficulty. And when even braking, it's a good thing is that 20 minutes after he could park his car, he felt better, and he felt dizzy, and he saw double vision, and has a bit of speech difficulty as well as balance. There was some difficulty. And afterwards, we diagnosed him of having stroke on the left side, the vein on the left side. And the third case, this is a woman, a 67-year-old housewife, who is very active in church, and he has high blood pressure. And although he's taking blood pressure medications, but she doesn't take it all the time. So it's at 150, 160, and makes her anxious. When she's anxious, high blood pressure goes up. He's borderline diabetic, not about 7 to 7.3 A1C, and his weight is a little bit overweight, and also over the standard. One day she was at a party, nothing wrong with that, and all of a sudden she felt that the left eye, she could see only half of it with it. She was losing vision, and then on the right side of her brain, she felt a lot of headaches. So eventually we diagnosed her of having on the right side of her brain hemorrhage. So this was hemorrhage. So this was hemorrhagic stroke. So these three cases, these three scenarios, I'm going to share them with you and explain them to you, the risk factors of having stroke. Now, well, this is very good, you know. I have a few slides that I can share with you about the risk factors. Now, we're just going to go by the slides, and we only have about 15 or 20 minutes, so I have to go fast. Now, age, of course, as you age, the chances of having stroke is higher. After 55, the 10-year growth is double the rate. Those patients, one was 82, one is 86, one is 87. Everyone was over 65. As far as gender is concerned, males had a higher risk. However, females have better longevity. So it's still, as the female gets older, the chance of getting stroke is better. And then there's also family history, meaning if your relatives, your family, if those who have suffered stroke under the age of 65, you better watch out earlier than others. As far as race is concerned, in North America, textbooks say that in the Afro-Americans, Hispanics, they have a higher chance of suffering stroke. However, for Chinese, you know, for people from China, that's their number one killer. So other than that, there's also the post-stroke diseases are also very lethal. So we're talking about hemorrhagic strokes more frequent. So I'm going to spend a little time to talk about TIA, which is transient ischemic attack. some of them call that a minor stroke. So what is this? This is a temporary stoppage of blood going into the brain, and so you lose your vision when your veins get circulated again, so you're fine. So there are also warnings and forebodings for that. So if you don't watch out, you have a higher chance of having strokes. So if you have these things, you better watch out. And if you take blood thinners or baby aspirins or for your platelets, so you better watch out. And the second slide I'm going to talk about is there are many things that we can control, under our control, and such as hypertension. So the higher your blood pressure, the higher the pressure exerts on the brain. Now you can control blood pressure. This is one of the most important factors. And if your systolic or diastolic pressure are higher, so how do we control them within standards? Then we can reduce it by 45% the chance. What's the purpose? Usually the minimum is 140 and 90. But if you have suffered diabetes or hemorrhagic strokes, so you should watch out, pay more attention to that. Or if you have kidney diseases, that's at least 130, 80. You can get lower than that. Of course, some people fluctuate in their blood pressure, so we have to use 24-hour high blood pressure gauges to measure their blood pressure. So as far as treatment is concerned, of course, as far as food is concerned, low salt, where our nutritionist will tell you more about it. And sometimes people are lazy to skip on their medications. So we have to have a purpose. We have to have a goal. We have to reach our goal. So it doesn't matter if you have 3 or 4 kinds of chronic diseases, as long as you are healthy overall. Now, the other thing is high cholesterol. The second thing is high cholesterol. This will increase your chances of having stroke. There are 2 kinds of cholesterols. One is bad cholesterol, that's LDL, and it will clot your blood vessels. Good cholesterol, HDL, high density cholesterol, is to prevent strokes, to prevent vessel clots. So looking at one of the cases, the number 2 case, that person's cholesterol is quite high. And after the stroke, what's the goal? Well, we have to be very strict. If you have suffered a stroke, the LDL has to be under 2, lower than 2. Now, the most recent figure is lower than 1.8. The second case that we talked about just now, the bad LDL was 5.2. It was very high, so it wasn't easy. It wouldn't be easy to reduce it down to 1.8. However, every 1 degree that will lower our cholesterol, we can reduce between 20 to 25% of stroke risks. So sometimes we have to take a statin. So all those medications that only pharmacists can pronounce. And of course, we have to abstain from certain diets, some certain foods. We have to be very diligent. And of course, there are hereditary factors. So we have to be very careful when we take those medications. Now, lowering your cholesterol is not so important for hemorrhagic strokes, but for blockage of blood vessels, that's important. The third factor, let's talk about diabetes. Now, if your blood sugar level is high, so of course the chances of having strokes are higher, and it's like heart attack and those illnesses. So it will double the chances of having your first stroke. We've heard about A1C. What's A1C actually? This is sucrose hemoglobin. So if it's high, then the 3-month average will be, you will know that the average. What is the goal for that? For most people, the goal is at under 7. Some people are different. Some people are strict. As you get older, we are more lenient on that. So if you have high blood pressure, high blood sugar, that's between 4 and 7. That is between 5 and 10, 2 hours after a full stomach. So we are talking about the blood sugar that measured new. The last thing is atrial fibrillation. A lot of times when our heart beats irregularly, and but it doesn't mean that every time your heart beats irregularly is an issue. Sometimes you feel it, sometimes you don't feel the problem. And what's this anyway? So this is the upper atria. If the rhythm is irregular, then the blood tends to be stagnant, and then there's plaques, which will also block your brain, and then you will have a stroke. And we ignore it, the chances of having a stroke is 5 times higher. So there's also another kind of fibrillation, which is not irregular all the time. Once in a while, when you see the doctor, it gets very irregular. So how do we know if we have a problem? That it's difficult to detect that problem, but this again will affect the risk factors, because so sometimes we have to be vigilant 24 hours a day, especially now that there are medicine. Dr. Ho will explain to you about that. Like you can wear watches to monitor your vital statistics. So there's a lot of medications out there and new knowledge that will help us lower the risk factors. But we're not talking about aspirins. If we take those medications, these blood thinners, it will lower the risk factors a whole lot. And the first case scenario, the one was not taking blood thinner, the patient. So as for the other, that's the second slide. Please flip to the second slide. Thomas, well, because of time constraints, we have about 5 minutes left. So I'm very grateful. Maybe you should just like finish with this slide. Yeah, I can finish in 1 minute with this slide. Actually, as far as life style is concerned, we can, if we are overweight, if our waistline, if for males, this under 90 cm for males, under 80 cm for females, and no smoking, and even a secondhand smoke is not good. No excessive drinking. A little bit of red wine is not harmful. And last of all, exercises are very important. So later on, we'll talk about exercises. At least once a week, 150 minutes of doing exercises. And mental stress is also important. The third case tells you that when you're very stressful, it will also affect the factors. So later on, we'll have a psychologist to tell you more about stress. The last slide is if you calculate all those factors, and the more of those factors you have, the greater the chance you have of a stroke. So I hope that everyone will remember a few things. First of all, prevention is the best medicine. So me, a doctor, is just like anyone else. I mean, so it's better to watch out before it happens rather than after it happens. So, okay, thank you very much. And I hope I wish everybody good health. Thank you, that was excellent. Of course, there are a few factors that we cannot change. However, there are some changeable factors. And I thank Thomas for the talk on this. And I also appeal to everyone that if you have questions, remember there's Q&A icon you can click on the right side, and we will answer those questions. And Thomas will come back during the Q&A session to answer our questions. Thank you again, Thomas. Thank you. Thank you. Now, we're at, before the second panelist comes, I have the second panelist is going to be an excellent talk. Now, I have a question for you. This is a poll question. Now, based on what we have learned, based on what I've learned, and I am now able to better understand if myself or someone I take care of is at risk for stroke. So do you agree strongly or agree, or just undecided, or disagree strongly? So we'll now open the poll for you to answer. I hope that you will participate in this poll. I see a lot of answers already. Thank you. Thomas, you were right. The majority of people strongly agree. So thank you all. And I also suggest to everyone that if you have any questions that you want to offer to share with us, we can answer them in greater detail. And again, on the right side, there's an icon that a question mark there that you click on it and pose your questions. So let's close this poll for now. We are going to turn to our second panelist, our second speaker. I'm very happy to have Jojo Wang here with us. Jojo, I don't need to introduce her to you. I mean, both she and Thomas are so famous. They're celebrities, but every time they come here, we learn new things. Again, thank you, Jojo, for coming here, for your time. Thank you. Jojo.
So there are many factors, and then diet obvious is one. And there is a saying in Chinese that shows people how high priority on food they have. And so if there are risk factors, can diet help to lower the risk factors? Oh, of course. So Dr. Ho has already mentioned some changeable factors. For example, the blood sugar, the fat. So most of that can be regulated through diet. And so before what I say, why don't we ask you a question, another poll question. So according to what you know, so which diet can help lower the risk of stroke? The first one is ketogenic diet. The second is high salt diet. The third is Mediterranean diet. And the fourth one is none of the above. So please choose your answers. I think our audience is very educated and they know how to manage health conditions. I can see that most of the audience have given a correct answer. So shall we close the poll? So over 50% has chosen the correct one. It is Mediterranean diet. So actually there was a DASH diet, and according to the DASH, it's pretty close to the Mediterranean diet. And the Mediterranean diet is even suggested a specific diet. So I have chosen to introduce this one. It looks like a pyramid. This one is English, and then we can flip to the next page, and that is Chinese. And underneath, it is at the bottom. So every day is the things that we do every day. And that one actually has nothing to do with our diet, but that is very, very important, and we'll come back to it. And one layer up, every day, most of the food comes from this category, and that would be a good diet. So what would that be? So mainly it would be more plant-based. So for example, vegetables and fruits, whole grains, as well as beans and then nuts or seeds, and also the healthy fats like olive oil and also herbs without salt. So that's why we suggest people to choose food from this category, and this will help your diet to be healthier. And going further up, you can see seafood and fish. Dairy, poultry. So these are high in protein, and we suggest take intake of that, but not every day. And these are healthy proteins, and also there are different vitamins and also, yeah, there is something to avoid though. For example, sausages, red meat, or processed meats like thick piece of steak. So these are more high in saturated fat, and we don't suggest having it often. And on the top is sweets like those desserts. And once in a while, that's okay, but not very often. And this kind of diet is actually proven by many books and studies, and it can lower the risk of stroke as well as diabetes as well as heart disease. And it is very good for diabetes patients to control their blood sugar, and also to help slow down the deterioration of our brain and causing dementia. So that's why this is being very held high up recently. Now you can see on the side, there is a bottle of table wine. So actually, intake of suitable amount is good, but the suitable amount is very important, and never to go over the suggested amount. And also try to lower the drinks that has added sugar. Make water your choice of drinks so that you can be hydrated. So I have talked a lot. So continue, please. So there's such a lot of information. How does it look like in a meal, and what are the key points? So for this special diet, the most important is to take in more high fiber foods. So as Dr. Ho said, cholesterol and the blood sugar have to be controlled. And then food that are high in fiber, they will be very good in controlling the blood fats as well as the blood sugar. And also those are whole grains and nuts and seeds, they have a bonus because they are rich in potassium. And when it goes into our body, it can control our blood pressure. So lower the salt. And mainly for salt, it comes from processed food. So sometimes we go for takeout or we eat out. And usually it is difficult to control the amount of sodium. And therefore, when we are cooking at home in an environment that we can control, we will try our best to lower the amount of salt, and also to lower the amount of added sugar, and that will control the blood sugar as well as our body weight. So many people say, oh, I don't put oil, but actually that is good. But so choosing healthy fats is very important and beneficial to our health. For example, olive oil or omega-3 fats, and they are very beneficial to our health. So let us look at our meal. How does it look like? Now you can look at this plate. if this is what you are going to consume in that particular meal, so bear in mind, half of it should be vegetables and fruit. I hope everybody can do this. Maybe it's a little bit hard, but at least out of the 3 meals, there will be 1 or 2 meals that you can fill your plate with at least half of vegetables and fruits. And a quarter of it should be a choice from whole grains, high in fiber. And there would be vitamin C as well as potassium. And the 1/4 would be protein. Many people say, oh, I'm getting older, I don't touch meat. Well, if you don't touch meat, it's okay, but don't forget to do other alternatives so that you can have protein. Because when we get older, we will lose our muscles. And if we lose muscles, then our mobility would be affected, and the overall mobility can be compromised. So therefore, taking in sufficient healthy protein like eggs, beans, or dairy products, and also meat. And every meal, you should have around a quarter of it to have being high protein food. And there will be water for your drink. If you can follow this practice in every meal, that will be perfect. And early on, we talk about the pyramid, and there is a bottom layer that we do every day, but it's not food. However, it helps to lower the risk of a stroke, because Dr. Ho said that if your body weight is too high, overweight, it will increase our stroke risk factors. However, Mediterranean food pyramid is actually our way of life. So actually, we do exercise every day, and we should be doing 115 minutes in a week. So if you are doing, say, 15 minutes, so do it 6 times every week would be good. You don't have to be very strenuous. You don't have to go for a long run or do badminton. You can just go out, take a walk, or do some stretching or yoga at home, and these all help. And besides doing exercises and staying physically active, it also not only lower our body weights, but also to strengthen our immune system. So everything has changed, and our stress level may be raised. And if we can take part in physical activities, and this would also reduce the amount of stress. And also communication with other people is very important. One of the things that is important in the Mediterranean diet pyramid is to have meals with family members and friends. So I know during the pandemic, it is much more difficult to see your friends. It's okay. So just like today, this health forum can be held, over the internet, and we can try to communicate with your friends. Or maybe you can have a meal in front of the computer, so over Zoom, and to communicate with other people can, talk about your stress, get in touch with other people so that you can lower your stress and have a much happier attitude. And there is one thing very interesting I would like to introduce to everybody. It is called Project Big Life. This is put together by a lot of professionals, doctors, and then PhD holders. So they have a calculator, different calculators, and one of them is heart attack and stroke calculator. So I tried it on my own. So although it is in English, you can use Google Translate and you can answer the questions. It won't take long, only 3 to 5 minutes. And if you translate it translate it into Chinese, talk about the age, the weight, your sex, and then your habits of exercise. So after answering your questions, it would tell you your risk factor of having heart disease and stroke. And during the process, you can pay attention to things that you can make changes so that you can lower your own risk of having a stroke. So why don't you go on to this webpage and then take a look. Thank you, Jojo. It's a very, very good presentation. I've heard this Mediterranean pyramid and how every meal it looks like. And also besides meal, how we should improve our health by physical activities and social communication. And also, I just like this calculator very much. I will go on after this forum. So thank you, Jojo. And it is excellent. And the next one actually is Dr. Sam Yip is going to come. So, and before that, I have another question to pose to you. So you have heard about how to improve your diet and to lower your risk factor. Immediately, based on what you have learned, are you able to understand how to lower your risk factors? And then now you can choose your answer. And I know that many friends begin to put in your questions in Q&A, and thank you. I would like to talk about ordinary, to say that we can talk about general questions, but we are afraid we cannot answer personalized questions. I think it's better to go back to your family doctor, or you can go to nurse line 811 and say Chinese. So we'll go back to the poll question. 2/3, they very strongly agree, and 1/3 agree. So thank you very much. And if you find that there is a certain information that is particularly good, or you have further questions, so please put them all onto Q&A. Okay. So let's go to the third. So I would like to invite Dr. Sam Yip. Sam is my colleague.
Sam is my colleague at VGH. He's also an authority on brain, on neurology. So if I have any questions about stroke, give him a call. I get an answer within half a minute. Thank you, Sam. I know that you're on a call today, and I know that you're still working on some cases in the hospital. So if there's some cases come in, you will have to attend to them. But I'm very happy to have you here. Thank you for this information, very excellent information session for everybody. Sam, I want to ask you something. Now we've identified some risk factors for stroke and how to lower those risks. Now, if unfortunately, I mean, people do suffer stroke, what to do? I mean, as a specialist in this, what kind of thoughts can you share with us? Well, usually we will tell people the first thing is to call 911. Actually, this is very simple. I mean, lately, if you see ambulances, they will have something that has something stuck outside, FAST. So maybe there's a slide for this. So it's the third slide, right? It's this one. So this is FAST protocol. So what does it mean? What does it stand for? Every letter stands for something. Face, F is face. So if the face is drooping, or if it's distorted, a little bit distorted even. The second thing is arms. So you have to be able to raise both arms. If you cannot raise both arms, or if they droop, or if one side falls, or if you're not strong enough to raise both arms, maybe that's also a symptom of having stroke. The third thing is speech. If you have trouble talking, or slur speech, or jumbled speech, or like someone who's drunk, or if what you say is people don't comprehend what you say. So those things are the symptoms. So if those happen, then time is important. So you have to call 911. I mean, if someone does suffer a stroke, so they should get treatment as soon as possible. Thank you for this very important hint. Maybe we'll step back a little bit. What is stroke? What are the symptoms? Maybe you can give us some reminders about this. Well, actually, the symptoms of stroke are very sudden. It's very acute. And you wouldn't know. I mean, sometimes there are warnings, but there's only 20% of the stroke cases. Like Dr. Ho just talked about many strokes examples, but most strokes have no symptoms, and they come all of a sudden, and then one side of your body cannot move, or your face droops, or you cannot raise your arms, or you cannot speak properly. Those are the symptoms. And sometimes you cannot see with one eye, or maybe you lose half of the vision. Sometimes you have vertigo. Maybe it has to do with your inner ear. Maybe it could be stroke. Okay. But if it happens often, if you have vertigo often, it doesn't mean that you have stroke. But if you never had vertigo before, but all of a sudden when you wake up one morning and you feel dizzy, the room is spinning and that sort of thing, don't ignore it. Don't just sleep and forget it. So thank you for those reminders. Now, if someone suffers a stroke and if they have those symptoms that happen to themselves or see others have those symptoms, what should they do? Well, if someone has a stroke, we'll have to make sure that the patient is in a safe place, that he will not fall from a dangerous position. And if he's face down or if his has head turned to one side. The other thing is to call 911 and tell the operator that it could be a stroke, and then they will, and then tell them that you've done the fast protocol, and then one side of his body is drooping, he cannot speak. And then the second thing is call the ambulance, call for an ambulance and tell the paramedics that this may be stroke. And then they have to administer this another time for the fast protocol. If they determine the stroke, and then you have to find out when it started. Say if you're in Vancouver and in Richmond or in Delta, if you live in those places, then those patients usually are taken, they will be bypassed. If for the first 6 hours, they will be transferred directly to a VGH emergency. And I'm sure you know that once you get a call about a patient having a stroke coming, then the stroke team will get the heads up and know that the patient with a stroke is coming. So we will, as fast as possible, take that patient to emergency or wait outside emergency desk, and at the first instance, we'll treat them. And then we have to do a brain scan, and then we'll have to see types of strokes, right? So that's Dr. Ho talked about that there's hemorrhagic stroke, and there's also TIA, but usually in North America, usually it's a TIA. That means that the brain, the blood vessels in the brain are blocked, and then the lack of oxygen is supplied to the brain. So those things were, over these last few years, we have new medications, we have technology to help patients. Another type is hemorrhagic stroke, and that's the next slide. So that means the blood vessels has ruptured, and then there's blood leaking into brain tissues and affecting the normal functions of the brain. So this it's difficult to differentiate different types of symptoms. You probably wouldn't know offhand that whether it's hemorrhagic or TIA. So you have to do a scan to find out whether there's hemorrhage in the brain or something else. Well, thank you for your explanation, Sam. So that's why when someone suffers a stroke, go to the hospital as soon as possible. I know that from experience. And if I call Sam, I know within 5 minutes whether that's confirmed. Someone will call up ambulance, and the ambulance, the paramedics we already in touch with Sam. Now, what are the treatments? What kind of treatments? How come you need to have a 6-hour bypass to get to you? Actually, the brain cells, when they lack blood, it doesn't die right away. It takes a little bit of time, and during that time, usually within the first 4 to 6 hours, but every minute is important. Every minute, about 2 million cells die. So every minute it counts. So the sooner you get to the hospital, the better we're able to help you, especially if it's TIA. Then we can circulate the brain again, circulate the blood supply, and the chances of survival are greater. Actually, there are 2 types of treatments. One is using medications called TPA. Actually, that's been around for about 10 years. This is a blood thinner, which is you inject into the body, and then it just dilutes the plaques. So you need to inject that medication within the first 4.5 hours when the symptoms have onset. And the other treatment is quite new. It's only come out in the last few years. It's you do a small surgery, a small procedure, put a catheter into the aorta artery, and then goes into the veins to the brain blood vessels, and then you use a contraction to take out that blood clot. And that kind of technology, when people suffer that kind of, is very tragic. About 60 to 80% of those who suffer that kind of stroke will die or will be handicapped. I won't be able to go home. I won't be able to talk. And so usually they need 24-hour care. So this new treatment, we can see the blood clot. We can take out that blood clot, and that kind of treatment can reduce the disability risk factors by 30 to 40%. So every 3rd person that we treat, 1 of them can go home. So a lot of in VGH that's being practiced to further lower the risk, of disability from strokes, those aftermaths. So that's why time is brain. Time is brain functions. So come to emergency as soon as possible and receive treatment as soon as possible. Because that's great advice. So in summary, so what are the things that we should watch out for? Well, if you suspect you have stroke, if you see yourself or your family or friends who have speech difficulties, with face drooping or cannot raise their arms, don't just tell them to sit down and drink a cup of water, a glass of water. Call 911 right away and send that person to the hospital, because we do have ways to treat that. And it's quite strange, because just before I joined the meeting, this forum, I I was treating patients in emergency. One of them just yesterday, right, 3 times here. One side of his body could not move. For the first time, 4 hours, and then second time, half an hour, and then third time, 30 minutes. And he was telling the family doctor in the afternoon, the family doctor said, go to the hospital right away. He didn't do that. She said the symptoms are gone. And then later on, then he was admitted it's dangerous, you know, because maybe the next time it happens, he won't be so lucky. So we call that TIA, a transient ischemic attack. So do not overlook those kinds of, because 30% to 40% of those people may suffer major strokes. So we want to reduce the chances of those recurring. Face, arm, speech, and then call 911 right away. Time is brain. Time is brain functions. Thank you, Sam, for that awesome talk. Yes. Now, if you still have questions, let them come in. And then let's look at the next portion. And then after that, Dr. Ho will talk about rehabilitation. There are many factors in rehabilitation, so don't tune out. So another question, you've just heard that about yourself or someone else having a stroke. Do you agree or disagree with those things? You know, you now have knowledge whether you have agree, disagree, undecided, disagree or strong disagree. Now we've opened the poll question. Again, the Q&A is still open. If you have any questions, give them to us. We will answer them. Personal questions, well, ask your family doctors about those and they will address them. Oh, great. Again, 80% strongly agree Sam's information. You've given them a lot of knowledge, and 20% agree. Another 20% agree. Thank you very much. And if you agree, and we want to know how come you agree. If you have questions.
So we are going to the fourth speaker. And again, I'm very happy to have Dr. Richard Ho. And he is a physical and rehab medicine specialist. So we have already heard Dr. Ip that people who had a stroke, there are chances that they recover. And there are chances that they might have symptoms left over from stroke. And we are very happy to have Richard here. And he is going to talk about after stroke, what is the rehabilitation process? So Richard, thank you. Thank you to take time from your busy schedule to come to talk to us. Hello, everyone. Thank you to have me here today. So I would like to ask you, so after a stroke, the recovery, how does it look like? So what problems may come up so that we can handle that? Okay. So after a stroke, first of all, we will see which part of our brain has the stroke and which area would be affecting our body. For instance, so if your left side has a stroke, many people will suffer problems with weakness or loss of sensation on the right side. And if it's a TIA, a minor stroke, and there are a few that may happen. But if it's very serious, out of the 20, I've seen patients who had them all. So above, I have 20 things that can be affected by strokes. The first one is after one stroke, there can be another stroke. And many a times, the second time would be even more serious. And the second thing is when you're talking, chatting, you cannot manage. And when people talk to you, they do not understand your speech. And also, you may have problem with your bowel or bladder, incontinence. And also, you have cognitive problems like losing of memory and thinking. And the next one about the joints, one side can be very tight and the balance would be very badly affected. You cannot stand still. And also there could be depression, difficulties with the swallowing. There will be imbalance of your face drooping. And many people, there is some problem with the shoulder, a lot of shoulder pain. We call it hemiplegic shoulder pain. Yeah. And the next one, you may be having hemispatial neglect. Well, it seems that the one side of the body, you don't have any connection, and you may have loss of hearing. You have neuropathic pain, and your vision can be affected. There can be blindness, and sometimes you can see, however, you do not recognize the faces of family or friends. And also there could be no sensation. And there will be, I've talked about neuropathic pain. You may have problems with walking. There may be seizures. And also one side of your body having muscle tightness and weakness of limbs. Many people would experience fatigue after a stroke. And all in all, there are many problems affecting us physically. Of course, the best thing is not to have a stroke. Thank you so much for your explanation. So there's a lot of risk. So if I already had a stroke, I've heard that there would be a lot of help from the rehabilitation centers. And if they provide help, if I work very hard, then everything will be back to normal. So can you say a little bit about that? So for the rehabilitation centers. So if you are lucky for minor strokes and your body may be able to return to normal or close to normal. Most people, the body can improve. However, it will never be the same before. So first of all, if you go to rehabilitation programs, the team would check on your condition to see which areas are affected, and they would try to find means to help you recover. However, so going to rehab doesn't mean you will fully recover. So for instance, after a stroke, so I am weak in my leg, and it's difficult to walk. And then if you go to rehab, although you can still walk, or you may be given a cane or a walker to ask you to try walking. However, if you cannot manage walking, so then you might have to use a wheelchair. And also another example is after stroke, you cannot speak or carry on a conversation, then you will go to the speech pathologist who will try to help you resume your speech. They may teach you how to move your tongue and your lips, so gradually your speech may be improved. And if you still cannot speak, they would find alternative means for you to communicate. There may be a computer for you to punch in your words or pictures for you to express your thoughts. So all in all, your rehab teams would try to look for different means to help you to recover as closely at the best you can. For example, like putting on clothing, toileting. However, not everybody can go back to their normal self. Oh, I got it. So if I have a stroke and I had to be admitted to the hospital, and I may see you in the hospital. Or after that, I may see my family doctor. So would my family doctor refer you to the rehab centers? How can patients assess your service? So actually in the hospital, if you are not sure whether you should join in a rehabilitation program or which one you should go, then you should ask to see a specialist in the rehab team. So usually in Vancouver, they would send one over to check on your condition. In Vancouver, there are two means for to do rehabilitation. The first one, and that is outpatient rehab. So if the hospital team think that it is suitable for you to go home safely, so they may arrange and discharge you, but join the outpatient rehab. That means you go home to stay there, but during the day, maybe 3 to 5 times a week, you would go to the rehab center to do rehabilitation. The second type would be directly staying in the rehab centers, and so the rehab services can be provided. And so if the hospital team feel that it is not suitable or not safe for you to return home. Now, let's say you still cannot manage going to the toilet on your own, then they would arrange for you to go directly from the hospital to the rehab centers. So depending on the seriousness of the stroke, so that the rehab specialist, after their assessment, so either go to inpatient or outpatient rehab. So which persons besides you as the rehab specialist, who else can help with their recovery process? Oh, I would like to say one more thing. So most people, if their stroke is minor, they could go to outpatient rehab. However, if it's medium level, most people would go to inpatient rehab. However, if it is really acute and serious, and it is possible that rehab would not be able to help. Now, for example, very serious stroke means the memory is so bad that even if you go to rehab centers, the patients cannot follow along the new skills. And then these patients cannot go home, they cannot go to the rehab centers, so maybe they have to live in long-term care with 24-hour care provided. Oh, I see. So of course, if we have a stroke, we hope that Dr. Sam Ip will bring 100% recovery. And also, even though not, it is medium and slight, not serious. And otherwise, the rehab programs will be very helpful, right? So maybe during the recovery process or rehab process, so what other specialists would be helping along? Yes, if you go to the rehab center, there are a lot of people who are helping. So the most important person is yourself, because you have to work with the other therapists to practice, to learn the new skills. And also your family is important because they give you support. And for the rehab therapists, there are a lot of them. The first one is the physiotherapist. They would help you movement, like walking, using the wheelchair, balancing, things like these. The second person is the occupational therapist, and they would help with the use of your hands, the skills, and to manage skills that you have to use every day. For example, changing clothes, taking a shower, or going to the toilets. Sometimes they can pay a visit to your home to see what adaptation they can have to improve the safety. For example, they may go to your washroom, they may have some grab bars. And also the third person would be the nurse. The nurse would help to inpatients to take care of the patients. And the next one will be social worker. The social workers would help arrange the transition of going home so that you can do so safely. And also there would be the psychological counselor. So they would check on your mood, and also the speech pathologist who would try to help with your speech, swallowing, as well as reading and making sounds. And also a dietitian, they would check on your diet. Wow, a lot of areas are being taken care of. So if one person is affected by the speech, then maybe the SLP is the person. And then if other areas are affected, then more specialists would involve. But I think one thing is important that you have said. The most important member of this rehab team would be yourself, as well as the family, because you have to work with the whole team. We are so grateful with you and the other specialists. However, the patient himself and the family would be the very, very, very important member. So thank you very, very much. So the next section would be the Q&A. And then before that, I would like to thank Richard. Thank you, Sam, and thank you, Jojo. They will all appear in the Q&A, and then we are getting ready. And I'm going to invite Barbara to help me with it. And before that, I would like to do a few more poll questions. So the first one is about different healthcare professionals. So do you think that you have learned something new? So do you agree that they can help you with your stroke patient recovery? So we are opening the poll, and would you please respond by choosing your response? So while the poll is going on, you can still enter your question under the Q&A section. And we will try to answer your questions the best we can. And Barbara is actually doing a lot of work behind us, sorting out all the questions. And also let us look at the next question. Oh, we are still having number 5. We find that 70% say strongly agree and 30% agree on what Richard said can be helpful. We close that question and go to the next. This one, we have 2 more. The next one is, so this section provides information to help patients and family make good decisions about their health. So do you think this section, now because today is the first section, and tomorrow will be section 2 from 2 to 4. And what do you think of this section? Do you think this section does provide information to help patients and family make good decisions about their health? So you can also choose and respond. Thank you for your responses. So these questions are actually, well, not for you to respond, and also to prompt you. If you have further questions, you can post them on Q&A. So let's close this poll, and let's look at 7. So as a result of my participation, I feel more confident managing my health. So do you agree? Do you feel more confident managing your health, managing or preventing stroke? So, okay, thank you. And many people say that it is helpful. Some say, well, does not apply. So if you have your suggestion, or please let us know how further we can help you, so that you can further improve your confidence in managing your health, so that we can further learn from you. Question number 8. So I learned about community resources and services that are available. So today we have touched on a tiny bit of the community resources. We are going to talk about more tomorrow. And there are a few. We talk about outpatient rehab, whether that will be helpful. So please let us know what you think. Okay, thank you for your participation. And most people say strongly agree or agree, but some people choose, well, does not apply, or some would say disagree. So we would really like to hear what you think, so that you can enter your thoughts into Q&A, so that we can further help you. I think for questions, we would like to go to the Q&A section. I would hand the time over to Barbara, and also I would like to help all the specialists to be on panel. You can remember Thomas, Jojo, Sam, and Richard. So let's get ready. And Barbara is almost ready. I think she has all the questions in hand. So Barbara, here you go.
Okay, thank you. So the question column is very small, in small print. I have to wear my glasses to be able to read them. Let me see here. Aha. So here I have with me, maybe I should address questions from those who posed them when they registered. Lots of those questions about prevention and treatment. So we have Dr. Ho and other doctors, panelists who have explained the symptoms. Now, my first question is to Sam Yip, Dr. Yip. This question is about young people who are between 20 to 30 years old. Is it possible for them to have stroke? Yes, actually, it doesn't matter what age you are in. You can still suffer a stroke. We just had a case, pediatrician who is learning in our program about strokes. It's rare, but they happen. Even for people between 20 and 30 years of age, it's not common, but we've seen those cases in these last few years, in these last 20 years. Strokes are becoming younger. People who are in their 40s, 50s, they have strokes. So the reasons actually is similar to those who suffered strokes before. Diabetes, high blood pressure, high cholesterol, and a lot of those already have high cholesterol. They are not aware of that. They think they're too young, very young, they don't check it. But a lot of these things, these illnesses don't have symptoms, like Dr. Ho explained just now. Even if you don't have any symptoms at all, you may still have stroke. And if you find that out, maybe you have brain hemorrhage, or maybe your heart has grown larger, your kidney functions are not normal. So you have to monitor those regularly. We have blood pressure gauges in pharmacies. Of course, recently, because of COVID-19, you can't do that, but you can do that at home. Thomas, Dr. Ho, what about people who are young? If they have high blood pressure, high blood sugar level, So what should they watch out for? If they have a family history of that, should they watch out even more vigilantly? Well, I've said before that for people who have family history, maybe if your parents who already have strokes when they were young, or when they have heart illnesses, we have to be careful with those cases, because even if you don't feel anything, you should still check. Okay. And the next question, we can reserve it until tomorrow. Maybe we can see if Richard has any input for us. Now, this patient has suffered and recovered from a minor stroke. So, however, his tempers after getting older and older, he's now 72 years old. He's become impatient and very angry. So in terms of recovery, maybe physically it helps, but in terms of his temperament, maybe he has this unreasonable anger. So what's your view on that? What's your opinion? Well, we have to see where. If it's in the rehab center, we can have him see a psychologist, and then they will have some kind of program to change his temperament back to what it was before. If he's at home, his family members can maybe not talk to them in clusters, maybe just one-on-one discussion, or sometimes tell them to do some exercises. That way, when he's tired, he is not so irritable. And also when sometimes if you can ask people to come in, for example, you can close all the windows and turn off all the lights at night. So those things you can do it. You can do. So obviously, for strokes, not only do they affect the physical functions, mobility, they also affect the brain functions, cognitive skills, and cognitive functions. So someone who has had a stroke may feel that some discomfort physically, may not be back to normal 100%, and they may feel that, well, emotionally, sometimes he cannot express those frustrations, and if he tells those people don't understand, so this may affect them. So this would may affect his emotions, make him confused. So tomorrow we will have a psychologist to tell us more in detail about the psychological aspect of strokes, what influence a stroke has psychologically. Thank you, Richard. Now, the next question is for Thomas. 2 years ago, there was a doctor who had a CT scan of a patient and found out that both sides of the head has very mild stroke remnants, but they recovered. So what should he or this person watch out for in future? Well, sometimes the very, very minor blood vessels that are clogged or may not have very obvious symptoms, but taken everything together, it can become serious. So you have to reduce that as much as possible. You have to have a balanced diet, do more exercises, watch out for your blood pressure, your cholesterol, your blood sugar, and also check whether there's an irregularity in your heart rhythm, and whether there's atrial fibrillation, those things. So prevention is the medicine. of course. And so to prevent major strokes, to prevent major symptoms, the onset of major symptoms. Thank you. Jojo, this one is for you. Now, it's also about preventative measures in terms of diet. Now, for bad fat, when it comes to preventing strokes, it's not good, of course. What can be done to make the blood vessels softer? Any foods after you have taken them that it won't become so rigid, so clog up? It's not so easy. First of all, if you, like Dr. Ho just said, that there are 3 highs: high blood pressure, high blood sugar, high cholesterol. You have to lower them before your body functions are normalized. So if those things are high, it will affect the functions of your blood vessels. And high in those things are also affect. As far as foods are concerned, Dr. Ho's mentioned about foods that affect cholesterol, and there are good and bad cholesterols in the body. If the bad cholesterol is too high, it will affect your blood vessels. And yes, eat high fiber foods, because high fiber foods can help reduce your cholesterol. Of course, we'll have to coordinate with other kinds of nutrients. So don't eat high saturated fat foods. For example, barbecued pork or barbecued pork bellies. And so try to avoid coagulated fats. For pastries are concerned, you can eat egg custards or pineapple buns, favorite among the Chinese speakers. And but there are manufacturers when the blood vessels are clogged. Of course, we have to eat a lot of vegetables and fruits. Those will be helpful, and even good proteins. Put oil, because foods that are rich in omega-3 oil, or beans or lentils, and those are helpful for your health and elevate your good cholesterol level. Of course, if you're a smoker, stop smoking, because smoking can also help harden your blood vessels. And don't drink too much alcohol, so that your liver can function properly. That will be helpful too. Thank you, Jojo. Wow, when you talk about food, there are lots of issues, because Chinese love to eat. So the major issue has to do with foods. The next question is a very interesting one. This one is for Kendall. Dr. Ho, now, is it a good idea to buy an AED machine? Because he said that an AED, when you use it, even if you're not trained, you should know how to use it. What's your view on that? Well, that's a good question. Now, AED is automatic electronic defibrillator. This is it. How come it's electronic? Because sometimes people, when they have heart problems, because heart rhythm irregularity of the heart stops beating, you have to use this defibrillator to help trigger the heartbeat. And of course, in emergency, we have those machines in the hospital. There are many places in the public, for example, in department stores or some buildings, even have these automatic electronic defibrillator, AEDs. Now, the benefits of those are that as long as you put 2 patches in your chest area, that machine will automatically pick up the heart rhythm conditions. to see whether they need electricity to help it. So the person himself does not have to know anything about heart or heart rhythm. So this is a very good machine. Some people will say, well, under those circumstances, can we put one at home? If you have one at home, maybe for those people who have high risk of a heart failure or heart disease, is better. I know that some families put one in their home, but I've just checked on the internet. This is about it costs about $600 to $1,000 for one. So if you buy one, it's a good thing to put home. But again, in public places, many of those have those machines put in there. So thank you for the question. I hope you have addressed your concerns. Sam, the next question is for you. Someone is asking, someone who has suffered a stroke and also high in cholesterol, high blood pressure level, is a candidate for having COVID-19 vaccines. Well, actually, if you look back in the United States of America, what do you call those? Oh, FDA, Food and Drug Administration. Yes, they have published something for stroke patients. If it is very complicated if they suffer COVID-19. So our recommendation is that you get vaccinated. So far in Canada, we have approved Pfizer and another pharmacy, Johnson & Johnson, as well as another pharmaceutical company, or Seneca, something similar. Those four pharmaceutical companies, their vaccines are safe. They are not like those what we see in literature, in medical journals, what they publish, they will not increase your chances of having strokes. So you don't have to worry about being vaccinated. Of course, if they have high risk, you should get vaccinated. Thank you. Thank you. This question is for Thomas. Now, with COVID-19, this person seldom sees a doctor. So if he wants to take blood pressure, what should he do? How do you deal with that? How do you monitor or control your blood pressure? And another question is also about blood pressure. People who are usually like us have blood pressure was 70. What's the safe blood pressure? What is the safe blood pressure indices? The first question, of course, usually if you go to a clinic to have your blood pressure taken or to a pharmacy to do that, but nowadays we recommend people to have their own blood pressure machine, so that you yourself at home can check it. Because sometimes people say, oh, when you come to a clinic, because there is this white coat syndrome, you get nervous when you see a doctor. And if you go to a different place at different times, it's different. So you have to check it more often. So once or twice, reading it once or twice doesn't really count. So it depends on different times. And if you are cool, calm and collected and not after an argument with someone, that's again different. So the automated blood pressure machines, we can use them at home and check ourselves, and I recommend using that method. And the second question about what's the reading, what reading of blood pressure is good, what's bad? I mean, the lowest range is under 140 and under 90. If you have kidney disease or you have 130 or or some people who are more aggressive, and even it's 120 diastolic is still not a bad thing, unless you have other symptoms. Maybe you feel dizzy when you get up in the morning, or things like that. But if the systolic reading, the lower, of course, if you don't have any symptoms, other than the fact that you may have a stroke, and the lower the better. So for those who have low blood pressure, does it mean that the chances of having strokes are lower? But you have to control other factors as well, because if you do not, then there's high risk of having strokes. Thank you. This question is for Richard. It's about rehabilitation, about recovery. So this person has suffered a stroke. He's lost the ability to speak properly, that is. Is there a chance of recovery? And are there any strategies to communicate with them? I mean, are there any ways to help this patient? Well, just now, we've talked about the speech language pathologist who uses methods to examine ways for you to recover your speech. And sometimes they can teach you, coach you, how to move your tongue, your mouth, and then slowly you can practice and you can talk properly again. Sometimes if you really cannot talk, then they will find other ways, like use a computer to write, or use a computer to pick pictures. Mostly during the first 6 months after a stroke, the progress is the fastest. And after that, at 1 year, it's slower, but the progress is slower. And after 2 years, it's plateaued. Usually there's no more further progress. We need to use other ways to rehabilitate or recover, right? So at first, after a stroke, during the initial period, you have to be more diligent. I know that there is an elderly person who reads newspapers, reads books every day. He can read Chinese, English. Because of a mild stroke, it affects his brain functions. All of a sudden, one morning, he wakes up. He cannot read at all. He cannot even read ABCD, the letters of the alphabet. He said, how come I cannot read either Chinese or English? So he goes to a rehab, to outpatient, to a rehab center. He doesn't have to stay there. So after 3 or 4 months, he's gone there 4 or 5 times a week. And when he comes home, he has homework. So his family helps him out. So really, he even smiles, he laughs. I'm like a grade school kid. I have to learn all over again how to read. But he was very diligent. He was 82 at the time. So this elderly person really relearns how to read newspapers, how to read books. So he is really self-dependent on his own effort and his family's help, plus the speech and the language pathologist to help him to recover 95% of his speech functions. He's very happy that he can read again. So if you have a chance, or if unfortunately you suffer stroke, and there are so many medical professionals who can help you, so you should just grasp the good opportunity within the first 6 months. Now, let us see whether there are any online questions. I'm sure, Kendall, you've seen some online questions. Some of them I have to enlarge them before I can just fine print that. So let us continue to answer questions. We still have a little bit of time left. There is one question here. It's for Jojo. Omega-3 supplements, can they substitute natural omega foods? Well, actually, usually we recommend that you also eat other omega-3 foods such as nuts or beans or those things. So yes, you can get those from food intakes. But if you take supplements, right now, there are no definite dosage that you should take, but maybe 1,000 mg a day would be good. But you should tell your doctor that if you want to take supplements, you should consult your doctor first to make sure that your supplements do not offset the medications that you are otherwise taking. Kendall, you have some questions to ask us, right? Oh, you have so many asterisks here, I see. Okay, turn on your mic, please. Okay, there are so many wonderful questions. Now, if we are not able to answer all your questions today, tomorrow between 2 and 4:30, we have the second forum whereby we can answer your questions. Now, this is for Dr. Thomas Ho. This question is about smoking. Are there any, if someone wants to quit smoking, what are the ways to help this person quit smoking? Of course, smoking is danger. Thomas, anything to help us? The most important thing, number one, is your self-will, okay? Your determination. And there are many, many ways that can help people quit smoking. And actually, the government have free packages that you can get from the pharmacy to help you quit smoking for free. Some patches or some other things that you can take, you can eat. So many different ways that can help people just kill that urge to smoke. But the most important thing is your self-determination, your will. You have to be strong enough to want to quit smoking. In Canada is such a good country that the government offers free smoke quitting programs. Yes, right. You need to be determined. You need to be decisive. Yeah. So same listener asked Jojo, how much oil, how much salt, how much sugar each day intake? Is there a limit to those? Your daily intake? For sugar, we recommend that you lower your sugar additives like soft drinks, and try to lower those intakes. That would be better. There are no concrete numbers. Actually, it's difficult to keep track in terms of numbers. So try to eat less of those. For salt intake, there are numbers. It's as low as 2,300 mg, or some lower than 1,000 mg. So how do you calculate how much intake you have a day? So actually, there was a website that I just introduced to you, a calculator. There's a sodium calculator. You can roughly estimate how much intake of salt you have every day, or whether it's a serious issue. So it's called projectbiglife.ca. So we will try to post it somewhere. So again, try to eat not so much processed foods, but not so much condiments, not so much canned foods, not eating out so much. Those things will also help to lower your salt intake. Thank you, Jojo. Well, now it's like the World Cup time with an extra time. So 5 more minutes, maybe one more question. Don't be disappointed if we do not have time to answer all your questions. We have time tomorrow to answer those. But this question is for Sam Yip. If all of a sudden I have mild stroke symptoms. Maybe I cannot see only for a few seconds. And then afterwards, I recover, my vision recovers. What should I do? Should I call for an ophthalmologist or an eye doctor? Or if I lose my vision, what do I do? Sam, anything you can help? Usually for ophthalmology, if all of a sudden, if you cannot see anything, there could be several different reasons. It's not, it may not be stroke. It may be a retinal problem. So there are these other things that may cause a loss of vision. So see if you have this happen to you before, whether you have high risk factors, for example, other illnesses that may cause you loss of vision. So if it happens again, maybe you will lose your vision for the rest of your life then. So what I usually recommend that if you feel anything abnormal, then the best thing to do is to seek medical help. Either call your family doctor if you can see him the same day, or go to emergency. Because sometimes if you just say you've lost vision, okay, if it comes back, that's fine. It's possible that it may be stroke, maybe a forewarning of stroke. So thank you. And so if those things happen, contact your family doctor or call 811 and talk to them. And maybe they'll send you to emergency. Well, time is up for today. Q&A will continue tomorrow.
So right now we still have 3 polling questions, and let's look at the next polling question. And I hope that you can give your responses so that you can help us to serve you better down the road. And the first one we have is, so we are using on air today to join this forum. So do you find this experience positive? Strongly agree? So give your responses, please. Because this is the first time that we held a forum on air, and we have chosen this particular platform so that we can achieve the desired effect we intended. Okay, thank you. The next one. And as a result of my participation, I believe my overall health can improve. So whether strongly agree or up to the choice of strongly disagree. Okay, thank you. And the next one, and the very last one. So as a result of my participation, I believe I can improve my overall quality of life because I have learned about prevention, about diet, and how food can help. So do you agree? Okay, thank you. Thank you, everyone. Thank you for taking part in our section 1. And then the second one will be held at the same time, starting at 2 o'clock. And we are going to look further at management at home, diet and psychological effect, and also community resources. And we have 3 other speakers together with Jojo, who comes back. And we are going to have 4 speakers. And we would like to thank the provincial government and the Patients as Partners initiative for their support of iCON. And also, we would like to thank a few speakers today. So Dr. Ho, Dr. Wang, Dr. Yip, and Dr. Ho, and especially to Jojo who have joined us. And also thanks to the following partners and also the media. And we know that without their help, the public would not know when this formula would be held, and they are very helpful to promote this seminar. And also we have online health exhibition. So you can finish this section and go to the timeline and go on to the different health exhibitions. You can go in anytime, and there are other exhibitors. They have other information, and there are other events that are provided for you. And also, I would like to thank everybody for your participation, and I do wish to see you tomorrow. And if you do have any questions or feedback, you can go online to our website, and there is an email address, and please don't hesitate to send your feedback to us. And in case if you can miss today's forum, this forum will be recorded, and then it will be put onto www.iconproject.org, and you can look at and then go on to the seminar, like what you have done today. And time is up, and thank you very much. And tomorrow at the same time at 2, we are going to carry on our session 2. And if you think this forum today is helping you, please invite other friends to come. So, okay, thank you, everybody.